Have you ever wondered how the Israel-Palestine conflict, one of the world's longest ongoing political disputes, affects the health of the people living in the region? The genesis of this conflict takes us back to the late 19th and early 20th centuries, a time marked by rising national movements worldwide. In the heart of the Middle East, two such movements were on a collision course: Zionism, seeking a homeland for the Jews, and Arab nationalism, fighting for independence from Ottoman rule. The Balfour Declaration in 1917, promising a national home for the Jewish people in Palestine, added fuel to the smoldering embers of discord. As decades rolled on, the situation escalated, culminating in the partition of Palestine in 1947 and the formation of Israel in 1948. This sparked a series of wars and intifadas, or uprisings, embedding the conflict deeply into the region's fabric. As we've seen, the roots of the conflict are deep, and its repercussions are far-reaching. Now that we've set the stage, it's time to delve into the heart of the matter: how this conflict impacts health. As we navigate the labyrinth of strife, it becomes evident that the toll on health is multifold. The impacts are not just physical, but also deeply psychological, with ripples that extend far beyond the immediate. Let's explore this further. The ongoing violence is a clear and present danger to physical health. The risk of injuries, disabilities, and fatalities in the crossfire is alarmingly high. But what might not be so apparent are the long-term effects of such violence. A consistent state of fear and danger can lead to chronic stress, which is a precursor to a host of health issues from heart disease to diabetes. In addition to the physical health hazards, the conflict has a profound impact on mental health. Anxiety, depression, post-traumatic stress disorder, these are all common among those living through such turmoil. Children in particular are most vulnerable, with many exhibiting signs of psychological distress. The fear and uncertainty that come with conflict can leave scars that last long after the fighting has ceased. Then, there's the issue of malnutrition. With limited access to food and clean water, many people are unable to meet their basic nutritional needs. This can lead to stunted growth in children and weakened immune systems in adults, making them more susceptible to diseases. And speaking of diseases, the poor living conditions brought about by the conflict foster an environment ripe for the spread of various illnesses. Lack of sanitation, overcrowded housing, and limited healthcare resources all contribute to a heightened disease burden. In essence, the health impacts of conflict are a complex interplay of physical and mental health issues, malnutrition, and disease spread. It's like a domino effect where one aspect of health is compromised, leading to a cascade of other problems. The toll of the conflict on health is clear and significant. This, unfortunately, is the harsh reality of the Israel-Palestine conflict, a reality that underscores the urgency of finding a resolution. Each day of conflict is another day of deteriorating health for those caught in the crossfire. Nowhere are the health impacts of the Israel-Palestine conflict more evident than in the Gaza Strip. This narrow strip of land, home to nearly 2 million people, is witness to a health crisis of immense proportions. The ongoing blockade has led to severe constraints on medical supplies and healthcare services, making it incredibly challenging for residents to seek and receive adequate care. Everyday health issues are compounded by these limitations, turning minor ailments into potential crises. Essential medications are often in short supply, and the availability of specialized medical care is severely restricted. Adding to this is the impact of frequent power outages on healthcare delivery. Imagine the dire consequences when life-saving equipment in hospitals and clinics fails due to a lack of electricity. It's not just about the immediate danger, but also the long-term effects on physical and mental health. The Gaza Strip stands as a stark reminder of the health consequences of political conflict. This is a reality we must face, and a challenge we must strive to overcome. So, where do we go from here? The answer to that question is multifaceted and complex, much like the conflict itself. Yet, if we focus on health, the road forward becomes remarkably clear. International organizations and local non-governmental organizations are working tirelessly to mitigate the health impacts of the conflict. They are extending their arms, offering medical assistance, mental health support, and resources for disease prevention and control. They are the lifeboats in this storm, but they cannot calm the waves alone. For a lasting solution, we need to address the root of the problem. The importance of peace and stability in improving health outcomes cannot be overstated. Health thrives in peaceful societies, where access to medical care is unfettered, where children can grow and play without fear, where the air is not filled with dust from rubble, but with hope.